Let's turn our attention now back to the lockdown files from the Telegraph today. Basically, a whole series of 100,000 WhatsApp messages, which have been revealed by Isabel Oakeshott here of TalkTV. She has revealed those messages which she obtained by basically working with Matt Hancock on his memoirs, the pandemic diaries, pandemic memoirs. But she has decided, despite signing a non-disclosure agreement, an NDA, that it was in the public interest for all those messages to be disclosed, to basically make sure that we didn't see a public inquiry that took many, many years to get to any answers, if at all. It wasn't a whitewash, as many fear and expect it will be. Well, let's talk about this and indeed a latest study on COVID vaccines with Dr. Bharat Bankania. He's a senior clinical lecturer at the University of Exeter Medical School. Good morning to you, Bharat.
Good morning, Julia.
Thanks for joining us. When we invited you on the show, was to talk specifically about this study published in the BMJ about vaccine. We'll come to that in just a moment, if you would. Your thoughts on this story. First, we understand a number of days of different stories basically coming out of these 100,000 WhatsApp messages that have been given to the Telegraph, which basically reveal messages between the Health Secretary and Chief Scientific Advisor, the Prime Minister, other Cabinet colleagues, his advisors, about what actions they took at the beginning and during the pandemic. The initial disclosure is their front page. Hancock rejected Whitty's advice on care home tests. Basically, they say that these WhatsApp messages reveal that he rejected the Chief Medical Officer's advice to test all residents, not just those coming from hospitals, going into English care homes, and that was a conscious decision because he basically said it would muddy the waters, but also there was concern that he wouldn't hit his 100,000 a day testing in public, which was a target he had set himself publicly at a press conference, and that basically the implication is that the decision was made against scientific advice and that it cost lives. Your reaction?
Very upsetting because, Julia, I, in the front line, experienced all of this. People were discharged from hospitals into care homes that brought that infection. That infection went through the care home and a lot of elderly people died. Similarly, people being admitted to the care home just were admitted. They brought their infection. It spread like wildfire through that care home and a lot of people died. And we experienced it, and we know that Matt Hancock throughout has said these words like, we had a ring of steel around infection control. In reality, we never had that ring of steel. Yeah. We know people were being sent to the care homes, and then we know that they were infecting other residents in those care homes.
I mean, that's it. The one group of people, and again, Sweden admitted they made very big mistakes on this as well, but the one group of people who most needed protection were the particularly vulnerable, very elderly people, by definition, people in care homes. And yet there was a decision to, because the NHS was going to be under lots of pressure with lots of people coming in, let's just clear out that 15% of people who are in beds who don't need them, get them into care homes. They didn't test a lot of those people, seeded it in care homes. We know 18,000 people died of COVID in care homes in England in April to August 2020. Over the 2 years, it ended up being 40,000. But we also saw this extraordinary situation where people from the general public, we weren't allowed to go and visit our loved ones in care homes. We were banned from doing that. Lots of people died, frankly, from loneliness. I know so many people who's interviewed many of them whose loved ones had dementia. There's no way they could talk to them on an iPad. They couldn't be wheeled to a window to see them. So we had that. So the public weren't allowed in. And yet there they were, shipping in people from hospitals where COVID was rife without testing them and putting them in and allowing other people coming in who also had COVID without being tested. I mean, I'm not a medical expert. Even I can see that that was insane, and I don't need 3 years to have passed to know that. So why didn't the Health Secretary know that?
He did know that. He just took the decisions that he did. And I tell you, I was in the middle of this, and it was so upsetting that our loved ones, elderly people, frail, vulnerable, frightened, they died alone. It was terrible. Some of the laws, the regulations that we brought in to say you may not come in to hold the hand of your loved one whilst they were on their last few hours was also a terrible decision. And I did my best as I could in my domain to say, come on, nursing homes, residential homes, you need to be kinder, you need to be better. But I'm only just one person. This needed people like Hancock to change that thing of allow people to hold each other's hands in the last hours.
Yeah. Well, we were going to be talking to Diane Mayhew, who's co-founder of Rights for Residents, to those very family members who were unable to see their loved ones, she unable to see her mother. Some of these WhatsApp messages, they actually do reveal that Helen Whately, the then Care Homes Minister, and I berated her on air many times during this period, she was pleading with the Health Secretary in those messages to allow people to be able to go in and see their loved ones, and he refused.
Yes, it's so upsetting because we felt powerless because it was the law says you may not do it, and I used to think, what are you going to achieve? This lady, this gentleman is going to die. Why can't you let the loved ones come in and hold their hands? By the way, it was similar in hospitals where loved ones could not hold the hands of their in departing relatives or friends. And why? We could have done much better.
But again, there was a whole, this is the science, this is saving lives. We even had sort of nurses sort of boasting about how they prevented someone doing that. I mean, we've seen footage of a man just basically standing outside a hospital, screaming, begging, pleading to be with his wife as she died. I mean, I'd have broken in. You'd have had to call the police. And it is mind-blowing, the cruelty that was imposed on people with no scientific evidence behind it. Now, that's the issue that people like me and many others, and know my audience, we were fighting against for a lot of this period. I think you've always been, you and I will disagree on various different things, but you've always been somebody who tried to look at the evidence and tried to be fair-minded and medically minded on this. Is there any doubt in your mind now that an awful lot of the decisions, and I don't just mean the Scotch eggs, but I mean a lot of the decisions that were supposedly based on science were about saving even vulnerable people's lives, that actually they were taken for the wrong reasons? They were for political expediency, they were for appearances, they were for political ego, they were for protecting careers and reputations, and they weren't actually about following the science to save as many lives as possible. Do you accept that now?
I'm beginning to, and not only that, let me explain a little bit. So we sit there in emergency planning scenarios, and we never ever planned for people to die alone. We always made plans that if such a situation scenario arose, that people would be allowed to hold each other's hands and have a moment of peace and tranquility whilst they passed away. And then suddenly it was said, you may not come in because, and I know why it was said that, because they didn't have enough PPE to allow us to come in and hold our loved ones' hands. And that's why they made those made-up rules that you may not come in because it's a COVID risk. It wasn't a made-up risk because the doctors were seeing the patients. They had PPE. They didn't have spare PPE, so they said you may not come in.
Okay. Thank you very much for joining us. Really appreciate it, Dr. Bharat Bankania. Actually, I must ask you quickly, though, just about that BMJ study. Since that's what I invited you on about. Is he still there? Have we still... Oh, good. There's a study that suggests that COVID vaccination can reduce the effects of long COVID. Is this a study we should take seriously? I mean, given that actually people who are more likely to be vaccinated are probably also the same sort of people who are more likely to report long COVID. We know it's got very different, say, class and geographical distribution, long COVID, hasn't it?
Well, look, in short, long COVID is a function of your autoimmune system not behaving as well as it could. And the advent of giving you a vaccine and then resetting your immune system to not be in a runaway state is probably in the right direction. So whilst this study is small and we need to do a little bit bigger study, I think it is a step in the right direction. Okay. I've been talking to lots of colleagues and we feel it may be resetting your autoimmune system and get you back into feeling better sooner.
OK, well, we shall see. Dr. Bharat Bankania, thanks again.